And welcome back. When you hear the word hospice, okay, what comes to mind? Well, there are plenty of myths and misconceptions when it comes to hospice care. Dr. Michael Dozeman, he's a hospice and palliative medicine physician joining us this morning to dispel some of those myths. Good morning, Doctor.
Yeah, thanks for having me this morning.
And talk about this new podcast you got coming up too. We're going to get to that.
Sounds good.
Let's start with these misconceptions. Okay, when people hear hospice, I'm sure what people think and what you know is the truth might not line up.
There's a lot of stigma around the word hospice. I understand that. It's a very anxiety-provoking word. When people think about the end of life or I'm imminently dying, I understand why that makes people scared. The point of our new podcast, This Day and Age, is to help dispel some of those myths around hospice care.
Okay. Let's talk about one. I mean, what misconceptions and myths do you hear about hospice care? What are people thinking that's just not right?
So I think the most common thing that we hear is when people hear the word hospice, they think, I'm dying in the next couple of days. There's that stigma that, okay, if hospice is involved, I'm in the last days or week of life. That's not true. The only criteria for hospice is that two doctors say, this person may not be alive in 6 months. Okay. That is the only hard and fast rule. Certainly there's guidelines or criteria that we try to follow, but that's it. You don't have to be in the last days or weeks of life.
Okay, so the only criteria, 6 months. Two separate doctors say that in 6 months we expect this human to no longer be around because of whatever malady they're suffering from. So the benefits of hospice, why do people want to go to hospice care?
Yeah. The conversation I have with a lot of people is, if you know you have an incurable disease, you know you have a limited amount of time left on this earth, what do you want that time to look like? Okay. There have been a number of studies over the last decades, since the start of hospice, looking at what hospice provides to patients. Hospice has been shown to improve your quality of life. You have better symptom management. From an emotional standpoint, spiritual standpoint, people report better satisfaction scores. You have more control over your life. You're not spending all your time going to the hospital, going to see doctors. You're in the comfort of your own home. You're able to spend time with friends and family. And really, you have control over what you want that time to look like.
And Doctor, I think you mentioned something there that people might not realize. That hospice care doesn't mean that you have to go to a facility and live there.
Hospice will come to wherever you are. That could be in your home, that could be at an assisted living or a skilled nursing facility. Right. There are inpatient hospice units, but that is a very small fraction of the patients that we take care of.
All right. So it's good to know that you can be at home. And a lot of people, that's where they want to be.
Yeah. And that's really why hospice was developed in the first place, was to help people stay at home through the end of life.
There you go. So the origins of it were to have that care in home.
Yep.
So people could stay there. Now let's talk a little bit about this podcast. Has it launched? When are you launching it? It's called This Day and Age?
This Day and Age, yep. It launched, I believe, last week.
Okay.
And some of these topics that we're discussing right now, we go a little more in depth. It's about 25 minutes or so, and answering some of these more common questions that we hear from patients.
And in the podcast, is it you're hosting, or is it you and a friend? Are you bringing guests in?
Yep, so Phil Tower's hosting it. Just kind of what we're doing right now. Sitting and chatting and just talking about, hey, when we talk about hospice, what comes to mind? What are some of the myths surrounding hospice? What is hospice really? What does it look like? What can we offer people?
Well, hopefully this cleared up a little bit of those maybe watching here. Faith hospice care. Talk a little bit about that in the short time that we have left.
Yeah, so Faith hospice, well, first of all, let me back up.
Sure.
I think West Michigan is very blessed to have a number of great hospices around. I know a lot of the providers at a lot of the other hospices in the Grand Rapids and greater West Michigan area, and they do a great job. Faith hospice, I think, is unique just in terms of its faith-based background. I've said the name, but also I think we have a little more availability to have physicians come and see you in your home compared to some of the other providers around West Michigan. Okay. But again, I think there's a number of companies that do a wonderful job.
I think you hit the nail on the head with the first topic, which is for a lot of people, faith-based care is a big deal. It's the deal for a lot of these folks, and that's what you offer.
And obviously there's a lot of people who have no faith background who we take care of too. It's not something that is a qualification
to be in our service. Well, that's good to hear. And of course, all this great information. You want to check out this podcast or maybe you want to just go to the website, thisdayandage.org. We'll get you that great information as well. Dr. Dozeman, thank you so much for the information.
Thank you.
Appreciate your time this morning. We'll be right back.